here we talk about all health-related and beauty-related issues. We talk about balance of life.
Yes, absolutely. And one of the best ways to get balance in life is by getting good rest and good sleep. If you tend to be a person who snores, or it could be related to snoring or not necessarily related to snoring, is sleep apnea. We have someone who is joining us today, Mark Walsek, who is a former NFL ball player, so is an NFL alumni. And so we feel honored having him on the show.
Welcome, Mark.
Yeah, definitely. So what he is, he works with Dr. Dave Gergen, who is one of the foremost creators of sleep apnea devices, equipment, and it has a little bit to do with the dental side. So we're going to let Mark share a little bit with us about how these products work and where you might be able to get access.
Well, myself and Dave Gergen are associates with Pro Player Health Alliance, and we've organized ourselves to primarily try to spread the word and spread awareness about sleep apnea, educate people about sleep apnea, and through the NFL players, we've been able to be successful at that, and it's a great platform because people will pay maybe more attention when you have people that have played in the NFL that are suffering from sleep apnea, and that have had testing and treatment that has had such a dramatic improvement in quality of their life.
Sure.
Me being one of those guys, I was diagnosed with sleep apnea about 2 years ago, and it's crazy because it was so severe that when my test results came back, and I was able to do a simple home sleep test, which was very effective and easy to do. I brought the equipment back into the doctor, and he read out my report and told me that I should go to the hospital.
Sleep in there.
I should go to the hospital tonight. Yeah, he says, you really need to go to the hospital because I can't treat you. I mean, I can't get you in a CPAP right now, and I can't get you into an oral appliance right now.
Okay.
And I went to this doctor on Dave's referral, Dave Gergen, his referral. So I was quite frustrated when I left the office, and I thought, okay, well, I don't know what to do now because I don't really want to go to the hospital. So I called Dave, and I told him what happened, and he said, well, turn around and go right back into the office. I'll call the doctor, tell him to, I'll have him I'll make you an appliance because Dave owns Gergen Orthodontics right here in Phoenix, and they produce, 75% of oral appliances across the country. And so Dave, I went back in there, the doctor made impressions for me. And Dave so graciously made me an appliance that day.
Wow. And
I slept with it that night, and since that point my world has changed because I no longer suffer from sleep apnea.
Get some good rest.
I'm getting super great rest. I don't snore anymore. I wake up refreshed. I'm not fatigued. I'm no longer depressed. I've lost 40 pounds.
Wow, I was going to say, you're very fit. You're one of the better fit alumni I've run into.
Yeah, I've lost 40 pounds. And, I attribute it all because of the great sleep that I'm getting. I have much more energy. My mind is clearer. I'm more motivated. I kind of got into that routine where I was like, I know I need to go to the gym, but I just don't have the energy to go do it.
Do you have any guess how long have you had sleep apnea?
I know that I have had sleep apnea throughout my entire career, and I think, which dates back, probably, from this date back, probably 20 years.
Wow.
Because when I was when you're on the road in the NFL and you're traveling to a different city and you're playing on that Sunday. You're going to fly in and you're going to stay in a hotel where we're going to have roommates in the hotel.
Right.
So the guys that share in the room with me would say, buddy, you can't snore because you're keeping me up. And I kind of panic a little bit, so I'd kind of try to force myself to sleep on my side because, in the middle of the night these guys would get up and they'd be angry because they're not sleeping and I'm snoring. And those ashtrays that sit on that coffee table next to the bed were starting to be scary as a weapon. They'd throw that thing against the wall, and I'd wake up and I'm like, oh my gosh, here I'm snoring. But I know that I'd suffered at least back to the time when I was playing because I just sometimes a lot of times didn't have the energy. that I wanted, I needed. And I knew I was snoring. I'd wake up with very sore throats. I'd wake up with a lot of soreness in the jaw.
Okay.
And these are all symptoms and signs that you have sleep apnea. If your jaw is sore, if you wake up with headaches, if you're grinding your teeth,
Right.
if you have acid reflux, which a lot of guys do, called GERD, those are all signs that you're suffering from sleep apnea. The masseters are firing at night while you're trying to open your airway. Those muscles are trying to flex in a way to open that airway, and now your masseters are firing, you're grinding your teeth. If that doesn't open your airway, the next thing the body does is it shoots acids from your stomach to your
Trying
throat.
to wake you up. just
Trying to
like
wake you up.
need.
Exactly. Yeah. Except it's not an ashtray. It's acids being thrown up into your throat, and after a while that can build up in your mouth, and as you're sleeping, and it's going to deteriorate your teeth. So you have that problem to face, along with teeth being worn down, along with TMJ problems.
Sure.
But the great thing about the oral appliance that I use is called the Herbst device, and it maintains jaw position basically.
Okay.
It's a faceted mouthpiece. It's upper and lower, and it's made of a high quality, durable plastic material,
Okay.
and it's connected with a titanium rod on each side that allows you to adjust it, so you can move the jaw forward or maintain a position that's most comfortable, and that works the best. It keeps your airway open, so when you lay back at night, your jaw doesn't fall back and creates pressure with the tissue that's in there to close the airway. So what it does, it allows the airway to be non-obstructed, which is great.
It not only holds the jaw. It's funny that it's the tongue is related to the structure. So actually repositions your tongue
Yeah.
to get an airway open too. So.
Right, especially with football players, we've worked out our entire lives and we've had large necks, and the muscles in those necks don't go away; they just get flaccid, and that muscle and that tissue that's in there when you're sleeping becomes ultra relaxed, and that's what causes when you start to snore. That's a narrowing of the airway, and you're drawing air past flesh that's vibrating. Well, when it gets to a point where you're super relaxed, or that tissue just gets too heavy for the airway to move, that negative air pressure is no longer going to move the tissue. That's what the CPAP does, is it forces air past the obstruction, which is great. If you use it, it works. And I'm not saying I'm not a disproponent of the CPAP. It's just that you have to use it.
Right.
A lot of people fall out of compliance with the CPAP.
I had one patient telling me today it doesn't fit the mask.
Right.
You have to wear a mask for
Right.
CPAP, either through the nose or mouth. It has to fit. The device you have is personally made. I mean, it's
Right, it's a custom-made
Custom-made.
dental appliance
right.
by a doctor.
Most masks are not.
Right, and
So
they're
they may not
one
fit
size,
well.
kind of a one-size-fits-all. If they're not fitting properly, the air can actually affect your eye.
Oh.
Because if that air is shooting up and
Leaking out.
it's leaking out and it's drying your eye, it can damage your eye.
I see.
And so, but they do work and they are effective, and if people use them, they work. But if you're not using it, then it's no good to you. Now you're at jeopardy of losing, dying in your sleep and risking your health. The oral appliance works. It's simple. It fits in your mouth. It's comfortable to wear. It's adjustable. And you can travel with it very easily. You don't have to go through. If you're trying to get through the airport security
Good point.
with a bag of
Looks like a
equipment.
bomb.
Oh, it really does.
Well,
It's
yeah.
actually gotten a lot smaller, a lot more better looking.
Yeah.
But still, it's a package.
Wow.
You have to have, the oxygen supply. It's a machine, produces the airflow. Because CPAP means, the meaning of the four capital letters are continuous positive airway
Passing?
Pressure.
Pressure, okay.
Yes.
Uh,
So you have a machine there pumping. So it is a device.
Well, the thing too is that it's high maintenance.
Right.
Noisy.
You have to maintain it monthly. Or every 3 months you have to get new filters
Oh.
You have to get new hoses.
Wow.
And because there's air and because of bacteria that will build up, those things have to become, they have to maintain them and they have to be clean. You have to use distilled water. So, there's a lot of things that you have to do to maintain them. And a lot of people, quite frankly, are lazy and they don't. Or they just
Aren't we
get
all?
tired. Right.
Well, that's what's nice about the device, right? Is that
Right, it's simple, it's small.
Mhm.
I carry it with me wherever I go. Actually, I have a backup just in case.
Sure.
I did lose one once, and I panicked because I don't want to
Important
sleep
part of
without
life,
it. Yeah,
yeah.
and so even on airplanes, if I travel someplace and I want to sit and relax on an airplane and fall asleep, I'm a big guy. It's a little difficult sometimes because the seats don't come up
Yeah,
very
good
far,
point.
so my head's here or there. But when I get on an airplane, that thing goes in my mouth because I sit on an airplane. If I fall asleep, I tend to snore.
Okay.
And I know I've woken myself up at times on an airplane. I look around and I go, these people are not happy with me. It's kind of embarrassing. So, yeah, when I get on a plane, that thing goes in and I sleep peacefully. And it's been a lifesaver for me and for many other NFL players that we've been able to treat and test. Like I said, we've treated over 160 plus players to date. And last year at the Super Bowl, we were able to go and screen and former athletes there at the Super Bowl. This year we're going to be back in New York, testing and screening along with Dr. Archie Roberts with the Living Heart Foundation. We'll be screening players for cardiovascular deficiencies, which is great because they can take ultrasounds of your heart and your arteries and your neck, and they can tell you whether you have blockages or not. And so between the cardiovascular screening and the sleep apnea screenings, we're really trying to promote great health.
That sounds great.
Yeah, we're a big fan of that. Obviously, the show being Ageless Living is how to live the healthiest life you can at the age you are, whether that be 8 or 80, just having that good life. And, you've actually helped me understand sleep apnea better. I did find out that I grind my teeth. So this is something that maybe I should look into a little bit. I just have a little soft plastic thing that I put in there to stop grinding, but I wonder if I should look further into sleep apnea.
Well, the great thing about it is that the home sleep test that we have is a simple home sleep test. You don't have to go to an overnight study and have 1,000 wires hooked up to you. You can sleep in your own bed.
Okay.
So you actually have a study program.
It's a simple home sleep test that we could give you tonight. We could show you how to set it up. It's a simple monitor that fits, that clips onto your T-shirt, and then it straps over, the light strap that goes around your chest, and then there's a light abdomen monitor.
Okay.
There's a finger monitor that goes on along with a wrist that measures oxygen levels in your bloodstream and your heart rate. And there's a small little hose that flips around, it comes up and fits in your nose.
Okay.
And you push go when you go to sleep, and you wake up, you push stop.
Wow.
You take it off in the
Yeah.
morning, you take it to the dentist, and they're able to download that in the computer, and they're able to tell you how many times that you woke up during the night,
Okay.
how many times you stopped breathing throughout the night,
Okay.
how often how much you snored,
Okay.
and your oxygen desaturation levels in your bloodstream, which are very important. That right there is I think, the greatest indicator of whether or not you're breathing and sleeping well, because my oxygen levels were dropping below 65%.
Wow.
Yeah, which now that's when the doctor said you have to go to the hospital because you're depriving yourself of oxygen. You're going to die in your sleep. And I've been told from some doctors that you couldn't achieve 65% oxygen by holding your breath voluntarily.
Wow.
And so I was at that point I kind of panicked and just happy that I was able to get some treatment, and now I'm sleeping and my life is so much better.
That's great. When we come back from break, we're going to be talking a little bit more about the subject. So get your pencils and paper handy. We're going to be giving out contact information, how you might be able to get access to this information. I, for one, would love to get that test done too. So when we come back, we'll talk more about that. Don't go away. We'll be right back after the break. This is Kurt Wilhelm, the co-host of Ageless Living here on We'll Talk Radio in Voice America.
And this is Dr. Tom Lee. We'll be right back.